At this point, if your hospital is not utilizing locked units, security, and metal detectors on every unit, they do not give a fuck about you. Unfortunately, a social worker at Zuckerberg Hospital in San Francisco was stabbed to death by a patient who got a hold of a knife on the HIV ward. Attacks on healthcare workers happen everywhere in the hospital, not just the ER, not just the psych ward, not just from someone under the influence. And that is why we need better protection on every unit, in every entryway, from security, hands-on security, and metal detectors everywhere. Not to mention, social workers are at high risk for being attacked because they're the ones coming into the rooms giving the patients and their family members the bad news for no placements or no resources for that person. I feel like we've been screaming this from the rooftops for some time now, but we have got to do better in demanding our hospitals make a serious change and use some of their budget to help keep us safe. Often the rebuttal from administration when we request security and metal detectors at every door is, but what message would that send to the public? As if us getting harmed is not message enough. Let's go through this Burden of Violence of U.S. Hospitals report from 2025. This is a comprehensive assessment of financial costs and other impacts of workplace and community violence. Key findings from this report are violence, including workplace, in-facility, and community violence, abuse, and threatening behavior, is a significant public health issue affecting the U.S. health systems and communities. This incidence of violence has significantly increased in the U.S. over the past decade, with rising rates of assault, homicide, suicide, and firearm violence, which were further exacerbated during COVID-19. The study sought to estimate the financial costs and other impacts associated with workplace and community violence. Hospitals experience substantial financial impacts from violence. The total annual financial cost of violence to hospitals in 2023 is estimated at $18.27 billion. Pre-event costs associated with violence in the community and within facilities are estimated at $3.62 billion US dollars, primarily for preventative measures. Post-event costs for healthcare, work loss costs, and case management, staffing, and infrastructure repair are estimated at $14.65 billion. The largest contributor to total annual costs came from post-event healthcare expenses to treat violent injuries. So if it saves them money to prevent us being harmed or killed, why won't they do it?